All right. It is 6 o'clock, so I will go ahead and start with the introductions. I want to welcome those who have joined us. Also want you to know that sometime in the very near future, these presentations will be uploaded to our website, so you will be able to go back and see them there and watch them again. So I'm sure that you'll all appreciate those of you who have joined us tonight. Couple of things. I'm doing this virtually. It's a little different for a lot of people. So if you're on your screen and you look at, there's a place that has view, everyone, if you click on that, you should be in the side-by-side or the speaker view. That way you can see Carolyn when she's presenting as well as her slides. Everybody is muted now, and that's great. We want that to be the case. If you have any questions, you can do a couple of things. At the bottom of your screen, you'll see a button that says reactions. There's a place to raise your hand. Or what's going to happen is Carolyn's going to present, and then at the end, there will be time for questions and answers. So if anyone has any questions at that time, you can wait till then, and then you can unmute yourself and you can choose whether or not you want to turn your video on at that point. Otherwise, it's fine. Just give your questions and Carolyn can answer. So my name is Edwin Mailheisen, and I am the Director of Community Wellness for Arbor Health, in addition to being the Director of Rehabilitation Services. And we are excited about this first ever Wellness Week. It's under very unique circumstances, so we have to do all these things virtually right now. We had planned and hoped that we could do more in person, but things obviously are not working out that way. But we're grateful for technology and the ability to meet like this and to be recording. So I'm going to introduce briefly to you Carolyn Price, who is a licensed clinical social worker, and she's our behavioral health specialist at Arbor Health. She works at all of our locations at the Morton, Mossy Rock, and Randall primary care clinics. And she's going to be sharing with us a topic that I think is important. We kind of forget about it at this time of year because we're all kind of, I won't say getting tired of the heat and the dryness, but the rain's coming and the winter blues can come for many of us. And so she's just going to be sharing a topic with us, covering it on a great level for us, and then just answering any questions. So I'm going to let Carolyn introduce herself a little bit more and her background, and then she'll finish this off. Thanks so much, and have.
Thanks, Ed. I appreciate it. So as he mentioned, I am with Arbor Health. I've been with Arbor since February, and prior to that, I've been working in primary care for about 6 years. And prior to that, I was working in public health as well as a mental health counselor for a local mental health center. And I've actually lived out in this East County area for about 25 years now. So I really enjoy being in the rural community, and I enjoy working with the people here. And I enjoy, when I'm not working, enjoying our beautiful environment in which we live, the hiking and the skiing and different activities we have. So I did want to spend some time today, or this evening, just talking a little bit about the winter blues. And I'm hoping, I don't see any faces, but if there's a way for you to do a thumbs up and let me know that my volume is okay. I realized when Ed was talking that I had my volume completely off. So, okay, thank you, Edwin. I see some thumbs up, great. So what I'd like to talk about are the winter blues. And this is actually quite prevalent in this area. What we're gonna be, let's see if I can get there we go. So I'm just gonna give you a brief overview of what are the winter blues. We also talk about winter blues as being something like seasonal depression, and then how we can recognize them and what can we do to help prevent feeling the winter blues. So it is much more common in this area, predominantly because of our latitude. They find that areas which have a higher latitude, away from the equator, are more likely to experience the blues. And you'll also see on this chart that SAD is mentioned. SAD stands for Seasonal Affective Disorder, and I'll touch on that a little bit, but really what we're talking about today are the winter blues. And for anybody who's interested, Morton is actually at a latitude of 46.55. So we're right in that area where we may be experiencing the winter blues. So the blues are not to be confused with seasonal affective disorder. And I think that this is a common misperception that when I am working with somebody who's experiencing depression more prevalent in the winter time, and it kind of comes and goes, well, that's what we're really talking about is that's more of the transient winter blues. Seasonal affective disorder is actually a diagnosable condition that sometimes does require some medication management, and it is something that is considered a mental health diagnosis and requires more treatment. But it's usually something that lasts around the whole year as opposed to just the winter blues. Seasonal affective may have lows in the winter and highs in the summer, so that's why they call it a seasonal affective. But winter blues in general, if they don't meet the criteria for a major depressive disorder, generally people don't experience that significant change in their ability to function and do their day-to-day living. And the winter blues are essentially just, we experience it because we have less light exposure. And when we have less light exposure, it interferes with our wake-sleep cycle, which is our circadian rhythm. They believe that the reason why we experience this change is because the light impacts our development of melatonin and serotonin. So melatonin is that chemical that is produced at night by a gland in your brain, and it's what helps us sleep. So lack of light actually helps increase that production of melatonin. So you can just imagine if you have less light, then you're going to be having more melatonin production, which results in more fatigue and feeling sleepy. And on the other hand, serotonin is that chemical, that's our happy chemical, and it's what we use, or what our body uses for our happy moods. So sunlight is one of the ways we create serotonin. And so when we're having less exposure to sun, we then are going to be creating less serotonin and may feel less happy. So how do we recognize that we're feeling this way? A lot of people start noticing that with the changes in the days, around October is when they start noticing they're feeling a little bit more sluggish and they feel like they need a little bit more sleep. Some people mention that they may have more food cravings, carbohydrate cravings. We often talk about the comfort foods that we, the spaghetti and things that are high in carbohydrates, and so that's another thing that can be a result or contributed by having some winter blues. We also experience reduced energy, and sometimes people get a little bit more irritable. And other times folks may feel like they don't want to socialize. They want to isolate more. And, we kind of joke about just, putting on our pajamas and snuggling with some comfort food. But that really is pretty common for folks. The winter blues technically is limited to fall and winter. Again, this is a way we differentiate it between winter blues and seasonal affective disorder or major depression. And it's temporary. It lifts usually around February. And the other thing is not everybody experiences these different, all these different conditions. They may just experience one or two. So we don't always have all of these different things. Now, I will say that if a person is experiencing these and it's not lifting by February, then that's a little bit of a cause for concern. And we may be looking at something a little bit more indicative of a mental health issue or mental illness. So how do we treat the winter blues? The key thing to winter blues is that we're experiencing less light during the day because of our reduced daylight time. So one of the ways we try to fix that is we get as much light as we can. One of the best ways to do that is to have the blinds open as early as you can. Even maybe sleep with the blinds open. And so when the sun comes up, you are awakened, or, get some of that sunlight. It's interesting that when they've done studies about sunlight absorption, that we actually do absorb sunlight through our eyelids. And I'll talk about that a little bit more in a little bit. But even though our eyes are closed, when we have that sunlight coming in our bedroom, for example, that can also help with the winter blues. Very often, I recommend people go for a walk during the day in spite of our lovely rainy weather. They do make clear umbrellas that are these bubble umbrellas. They kind of go over your head, and those can be really helpful. And so if you can get out during the day around noontime when the sun is at its highest place in the sky, that can also help with the winter blues. And the other thing they've noticed is if we wear sunglasses all the time, in spite of high or low sun days, that can also impact the amount of absorption of sunlight we're getting through our eyes. And so for those low light days when you're not at risk of, having like some issues with sun exposure with your eyes, I would recommend not wearing sunglasses. And the other thing is with the blues, we have a tendency, because we want to sleep longer because our days are shorter, and our nights, starts getting dark at 5 o'clock in the evening. We do have a tendency to want to go bed earlier and stay and wake up later. But it's really helpful. In fact, our body really loves to be on a regular schedule. So anything we can do to just maintain the regular sleep schedule that you have, going to bed at the same time and waking up at the same time, in spite of how you're feeling, whether you feel like getting up or not, can be really, really helpful for the body and the brain. There are some other ways that we can help with the blues. One is a happy light, and the other is the clock. That both of them are a way to kind of simulate light and simulate the sun. So we'll talk about both of those here. This is an example of a happy light, and actually I have my own. I don't know if you can hold it up here to the screen. You can see that it's actually, here's a piece of paper. It is really similar, or just slightly smaller than the size of a piece of paper. And it's very portable, it's very thin. It's about the size of a small iPad or tablet. And this is called a happy light. This particular one's made from Veralux, as the example is on the slide there. But what it does is very bright light. It's 10,000 lux, and it simulates sunlight. And so it can be really helpful to help stimulate and energize an individual, especially if they're having a hard time getting up. Many of us, for example, in the wintertime, I drive to work in the dark and I come home in the dark. So I find that having a happy light can be really helpful to help my brain adjust and get me ready to go for the day. It's something that you just use first thing in the morning. It's not as beneficial later in the day because it actually will disrupt your sleep cycle. And what we're really trying to do is mimic the exposure we would get with the sun. Now, there are studies that they've done regarding a light box like what you see here on the slide, or something like this, a happy light. They've noticed that it has much more effective impact on our circadian rhythm and getting that back to normal. And they've also found some studies that it can be more helpful than medications. So instead of using like an antidepressant or something for energy, they found that light box or happy light can be much more beneficial. It's also faster acting. Most medications do not activate or get up to that therapeutic level in your bloodstream for between 4 to 6 weeks. And the benefit of this is it usually is effective within 1 to 2 weeks. So we generally get a pretty good idea about whether this is going to be a useful tool or not. The other things that they've studied, there was a study in 2015 about using these lights for non-seasonal depression. So they're looking at whether this may be a way to supplement or replace antidepressant treatment for people that have diagnosed major depressive disorder. And I think there's more study that's going to be worked on for that. The other thing about using a happy light is they've not done studies about using it for prevention. They generally recommend starting to use a light when you start noticing that you're having some slight symptoms of feeling more fatigued, more difficult time getting up in the morning. Then that might be the time to start using it. I recommend this tool a lot in my practice. I used to joke there was one year when it seemed like it was a pretty bleak year, and I joked about how all the waiting rooms needed to have happy lights put in them so we could get everybody exposed first thing in the morning when they came into the office. Okay. I guess I'll just say a couple things about placement because that's pretty important. I always put it to the side. I find that it's not disruptive. I use it when I'm drinking my coffee, going through emails or something, so I'm able to still see my computer screen. I'm not being blinded by this light. It is very bright, but keeping it within about 2 feet, not really further away than 2 to 3 feet, but within 1.5 to 2 feet from your eye level is the most effective placement for this tool. And if you have more questions about it, we can address those at the end. The other type of light to simulate sunlight is this dawn simulator. And I've not used one of these myself, but the idea is that it does simulate sunlight. So you may have seen ads for them in magazines or something or online, but they're like an alarm clock. But instead of using an alarm, they actually gradually light up. So they start as a very dim light. And then as time progresses, it becomes more and more bright. So it's simulating the sunrise. And that can also be very helpful. So what if the blues don't go away? If they're not going away, like I said before, if these sort of problems have been persisting past February, over past 2 or 3 months, then it's there could be something else going on. And it doesn't necessarily have to be a mental health issue. It could be something else that's going on with your physical health. So I would really recommend talking to your primary care provider. And your primary care provider can make a referral to behavioral health and to the program that I work in. We also have a psychiatrist. So that would be an option as well, just to get a better idea. There's also other things that we can do to help with, feeling better during the winter months. I work with people often on scheduling. I mentioned before, creating structure, having a regular sleep schedule can be really helpful. And there's other things that we can do to kind of help ourselves feel better, especially if we're noticing that during the winter time, we're not, engaging socially like we usually would, or we have a difficult time doing those things we ordinarily do just fine, like, I don't know, cleaning the house or doing any of the chores around the house, or, completing our tasks at work. So if it feels like things are not resolving, then definitely I would recommend talking to someone. And just a little bit about what the behavioral health program is for Arbor Health. It's a brand new program. We started it when I came here in February, I've worked in this program in other settings. And so, like Edwin mentioned, I'm in all 3 of the primary care clinics, and I provide brief assessments, psychological assessments, as well as counseling. And I also help people learn coping strategies so they can get through the day a little bit more easily. And so I treat a variety of issues from grief on up to just, people experiencing changes in their circumstances because of physical health issues or, job changes or things like that. And the way to access behavioral health services is to let your primary care provider know, or you can call your nearest clinic and request to see me. There's a insurance authorization process, but we can certainly get that going. So, all righty. So really quick, it was a very quick topic, but does anybody have any questions about anything here?
I'll ask a question, Carolyn. So what's from your perspective, the effectiveness of exercise with the blues as well?
Oh, well, exercise is really great because it's another way to release some of those pleasure chemicals. The endorphins can be really, really helpful. And again, creating part of that structure in our day-to-day lives is always beneficial. And just, I talk about the magic pill for treating depression. If there was one, it'd be the combination of adequate sleep, exercise, and a good nutrition. So exercise is also really helpful, especially during this time.
Have there been any studies that you have seen that have looked at the time of day exercise is performed in regard to the winter blues?
I've not seen anything specifically about time of day. I would recommend, if possible, to do it when the sun is out, so you're getting that sunlight exposure. Of course, it's very difficult if people are working during the day. But exercise is very often activating. So if a person is feeling really sluggish in the morning, I would recommend doing exercise in the morning to kind of help activate the brain and the body at that point.
Great, thank you.
Mm-hmm. One thing I did not mention is how long to use a light. I recommend generally starting out 10 to 15 minutes. I don't find it very overwhelming to use it. It's bright, but I don't have a problem with it. But using it just 15 to 30 minutes a day can be adequate to meet the needs of kind of resetting that circadian rhythm. So you don't have to sit in front of a light for hours and hours. It can be just 20 to 30 minutes is generally adequate. Some people do it a little bit longer. You just need to make sure that you're doing it in the morning hours, as opposed to, I generally don't recommend doing it after 10 o'clock, because at that point the sun's already up and you're going to be possibly impacting your sleep cycle. Any other questions? All right. Well, thank you very much for joining us this evening.
Great. I'm gonna just thank Carolyn very much for the time. I know we want to keep it short for all of you people out there, just to kind of hit these topics. I just want you to know that if there's anything that you need from us, we're happy to answer any other questions. And if any of you have any other questions, that's great. Also, you feel free to reach down. Okay, we have a message from Judy. She asked, do you feel like a Happy Light is better or the Dawn Simulator?
Judy, I have never used a Dawn Simulator. I would go with what is cheapest. I've been able to find Happy Lights. I think these have gone down in price on Amazon to around $40. I think I've seen them as low as $35. I don't know how much a Dawn Simulator is. And so, if that's something to consider, then, they're both effective. So I would go with the one that, fits within your budget.
It might make sense also, I was just thinking about that, Carolyn, as you were mentioning, it may also be depending on partly on your personality as well. If you're someone who can actually get themselves out of the bed in the morning fairly well to actually get to where you turn your light on. But some people, I know people who struggle during these times just to, they hit their snooze repeatedly. And maybe for someone like that, that Dawn simulator would really help because it just kind of adds to that part. Also depends on your significant other if you're, you know. But,
True.
but for sure, you know, that's just those little things that we can think about as well. Just a thought.
Mm-hmm. Good question. Thank you, Judy.
Yeah.
You know, I got to say that, yeah, the Dawn simulator, I'd never heard of that before. And that sounds like a nice way to wake up rather than my alarm going, eh. You know, I think I would like that.
I think I've seen something that actually has little tinkling bells that goes along with it. So it might be a little chime if you set it as an alarm. So you have the light would come up gradually prior to your alarm going off, and then the little tinkling bells. So
sounds
excellent.
Nice.
Fantastic. Any other questions out there or comments from the people who are watching? I don't see any. So once again, Carolyn, thank you so much for your time. Thank you for all the people who joined us tonight. Just want to let you know that we have another presentation coming in about 20 minutes. We're doing 2 an evening. I'm excited about this one. We have a new partnership that we're just finalizing with a group out of Clackamas called the Lifestyle Medicine Group. These are more than just dietitians. These are dietitians who are all advanced trained with chronic disease and the ways that we can use food to help. And we are excited to have one of those people presenting. She will be presenting at 6:45. So if you just want to, you can close out of this meeting, go right back to the website and just click on the next one. We'll be there and starting at 6:45. So that's my shameless plug for our next one. But there are also 2 other presentations tomorrow. One of my cohorts, Brian Geddes, a physical therapist, will be presenting tomorrow evening at 6 p.m. on exercise and aging. You know, a lot of times we feel like we can't exercise like we used to, and sometimes that's true, but that doesn't mean we can't. And he's going to be discussing that and talking about that. And then we're going to follow that up with a final presentation by one of our new providers, Dr. Podbilski, is going to be talking about an area that's very important to him, and that's called metabolic syndrome and diabetes. So I know it kind of sounds technical and all, but I think that's good information as well. So if you can't join us for the next presentation, please come back tomorrow. Tell all your friends. This is the first time we've done this, and so we want to really get the word out. It's not easy during these times, but again, thank you so much for your time. We're really happy that you joined us, and have a fantastic evening. Take care.